Welcome. Today's topic we're going to talk about burnt out. That syndrome, that horrible syndrome, burnout syndrome. We all experience it. We all know what it feels like to be burnt out. But sometimes we don't even know what it is. We look at ourselves and we are like, oh my God, I hate my job. Oh my God, I hate this. Oh my God, I'm so angry. Sometimes we burst into tears. Sometimes we are just complacent. We don't feel to do anything. No motivation. Just a blah feeling. That is the burnout syndrome. Have you ever finish a shift so tired, just exhausted, come home, take a shower, and next thing you know you're hearing a call bell ringing, or you're hearing an IV pump beeping, and you're like, oh my God, I am hearing an IV pump beeping in my house. That is part of the burnout syndrome. We all go through it. I brought this topic up because I know some of us think that no, not everybody experiences this feeling. We do. We all experience burnout. Burnout is the most horrible thing a nurse can feel, because our job, we take care of people, we take care of their needs, we take care of their lives. And if we are burnt out, patient care tends to drop. The percentage of the care that they get, they tends to drop. Nurses tend to resign from their jobs. That's why all over the world have a low retention rate of nurses. It's as if nurses don't like to stay in one place. That's what they say. They say we are nomads. We are nomads. Nurses are nomads. Nurses are nomads? No, we're not. We are not nomads. If you provide a safe and comfortable place for us to work, we will stay. We will remain loyal to that institution. But in all my years of nursing, I haven't reached a point where I can say, oh my, I love this spot. I love here. I can see myself climbing the employee ladder of this institution. Or if I do, I tend to see that most of my colleagues, they tend to change. They tend to forget what it was like being on the floor, a staff registered nurse, or a staff PCA, or a staff ENE, CNE, and we tend to make it worse for our colleagues. So burnout syndrome is very, 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 very occurrent in the nursing fraternity. We go through it a lot. Now, I've done some research and I have seen that they said burnout syndrome can be prevented. Burnout syndrome is something that is curable. So some of the ideas they gave were: 1. Employers are to protect nurses with patient to nurse ratio. So I did some research under the American Nursing Association. California is one of the states that was the first to pass a law based on patient to nurse ratio. So let's say for a med-surg unit, a basic med-surg unit, 1 to 5 patients. I'm like, what? 1 to 5? That sounds awesome. 1 to 5. One nurse, me, to 5 patients. Let's just think about that. So I have 5 people that I am fully responsible for. Whereas in some institutions, we have nurses with 1 to 7, 1 to 20. In Trinidad and Tobago, sometimes nurses go to work and they are on their own with a nursing assistant, with an entire floor, entire ward in different hospitals. It's crazy. I'm sure in different countries it happens. But I used to work in Trinidad and Tobago, and I work Bermuda. And I know that there are different places that people go through different things. So I think that that's a good idea. If they would fix the patient to nurse ratio, make it something standard across the board internationally, it will be something that we would look forward to, as knowing here what I can look forward that I am going to have 5 patients that I'm responsible for. Another topic they brought up was long shifts. Now, some people differ on that. Some people like to work 8-hour shifts. Some people like 12-hour shifts. I personally like 12-hour shifts. It means I will be in the hospital less days. But then there are the tricks that some people play. They don't pay you for your break. So then you're in the hospital more times even though you're booked for a 12-hour shift. So you see, employers have ways that they can assist us. So we need to make this known to the world. We need to let people know that these are the things that burn us out. So it's long hours, very recurrent shifts. So instead of doing 3 shifts a week, we do 5 shifts a week. Oh my God, I will be exhausted. Another thing is not providing a form of being able to relax, having activities, having staff appreciation. Even that staff appreciation. For example, there are some nurses, they come to work early all the time. They're punctual. Why isn't there a way that you can show these nurses you are very appreciative of that? Show us how much you appreciate us, not just Nurses Week, not just that 1 month in May, everybody is, oh my God, Nurses Week. No, let's show the nurses appreciation all the time for punctuality, regularity. Another thing, let there be upward movement available in the institution, not nepotism and favoritism. These are things that makes a nurse feel like, I shouldn't even be here. Why am I wasting my time? Why am I even doing this? Better I leave and go to another institution. These are the things that will help these employers retain nurses. And I know that my colleagues, you all agree with me. So we want better staff to patient ratio. We want better equipment. Instead of us having to be like MacGyver and we have to be making up different things with things that we are not supposed to be doing. It's supposed to be makeshift stuff we have to create. For example, to grind medication, we have to make sure and provide our own medication crusher. Now, you are in a hospital, you're in a clinic, you're in an office. You know there are patients cannot swallow whole medication. Provide the proper equipment. Provide enough blood pressure machines. We have to fight for it. Provide enough equipment for us. Be up to date. We are in 2021 where electronic charting is the way now. And I am sure there are still hospitals in this world that have nurses writing still. So the time I have to take to write or even to follow up on a medication order or order from a doctor, it takes me a long time to get it. Whereas with electronic charting, if the doctor puts it in, I could refresh my screen and get it immediately. See? Now, these are the things that we have to let them know. These are the things that we want to put out there. Better equipment. Show us appreciation. Better patient to staff ratio. We want upward mobility. We want to feel as if there's some form of care for us. Better health care. Better benefits for nurses. For example, some nurses have children. Sometimes we have to work late shifts. Let's say it's a midnight shift. And you're a single parent. What babysitter is going to be available to you to bring a baby in at midnight? Now, if the institution wants us to do that, don't say you don't care. That is not your problem. That you, as the employee, have to do that. Why? Why behave as if we are not important? Why behave as if we don't matter? Is it going to take so much just to put a little thought, a little effort into saying, okay, let me provide a 24-hour daycare for my 24-hour working staff? Would you think that you will have so much irregularities in people coming to work? Do you think people would call out as much? Do you think people would stay home from work? I don't think so. If I'm a mom with a little kid and I have to carry my child by someone for 11 o'clock and then find a taxi to get, or a maxi or a bus or a train to get to work, I mean, it would be a lot easier if I could come one direction. My child is in the hospital where I am, so my mind is at ease and I have to come and do my job. Now I will function better. So you want a 100% functioning nurse. You want a nurse that is not miserable and unhappy and ready to resign and willing to be loyal to the institution, provide better benefits, provide better patient ratio, provide better respect for nurses, appreciation, provide things like daycare, 24-hour daycare, provide better health care insurance so that nurses feel like they don't have to leave this specific hospital to go to another hospital that provides better health insurance. Because we are people too. We have children too. We have husbands. We have parents, elderly parents that we have to take care of. So these are the things that causes burnout syndrome. And I know all of you that are looking at this video today, I know you have experienced at least one. And I know these are the things that you once said. That if these employers, these grand institutions that know and hire nurses and they want nurses and they put out these ads, they want nurses, that if they would do these things, they won't need to be recruiting nurses so much from all over the world. And we wouldn't have to be nomads. We can be steady. We can stay one place. We can be happy. Who don't want to have somewhere that you have equal opportunity? Who don't want to be employed in a place that you feel like, yes, I matter. I matter. My effort matters. Patient recognition. Patient recognition is such a nice thing. When patients they recommend a nurse and say, oh, nurse A was awesome. And you know you recognize the nurse. Give us inspiration. Not look at us as, you know, you have to do the job. I hired you for that. No. No. You don't speak to the other staff like that. The other staff members are treated with respect. And I don't need to call who they are. We all know. They are treated with lots of respect. They are given lots of stuff and lots of perks. We just ask for simple things. Simple things. Things that we think should be understood. Now, let's talk about the way that we can help ourselves with burnout syndrome. Take vacation annually. Make sure and take your vacation. Now, I know some of us, we live in a way that our vacation is to go and work in another hospital. No. Take vacation. Take that time and relax. Do not do any nursing. Do not do anything regarding nursing at that time. Find somewhere nice to go and enjoy yourself with your family. Another thing we can do is when we get home, turn off your phone. Don't do every single overtime there is. Regularize yourself. Know how much is your maximum. Do not tell yourself, oh, I will work 3 nights at this hospital, sleep 1 night in my house, and then work 2 more nights in another hospital. By the time you come back to your main hospital, you are tired. You're irritable. You make medication errors. You become exhausted. No, no. We have to learn to regularize ourselves. We have to understand that we need to take care of our bodies. We need to eat healthy. We need to eat the way we teach our patients to eat. We need to eat like that. I, for one, know that because I am overweight. So I definitely know. We need to eat properly. Not eat snacks on the night shift. Not order KFC and pizza. No, but eat healthy. Healthy snacks. Another thing works for me is positive mindset. Listen to positive things. Don't dwell on all things negative. Don't sit down and just be all talking negative stuff. At least for 30 minutes every day, sit down and listen to some positive mentorship. Listen to something that is positive. You could go on YouTube and listen to anybody with positivity, with mentorship and motivation. And do that every day. And take at that time, just you and yourself, and you listen to that video, you zone out everyone, take some deep breathing, meditate. These are things will help us with burnout syndrome, guys. These are things have been proven to work on our bodies, to help us to feel that feeling of, okay, I can go again. Another thing is exercising. And guys, I don't like to exercise. But recently, because I have been so grumpy and sometimes weepy, I've been crying and going through my burnout syndrome, I started to walk. My husband told me, come and walk. He's been telling me to walk for months, and I'll be like, crying and telling him, you don't understand because I'm so tired, I'm always tired, and you want me to walk? How can I walk and I'm so exhausted? Are you mad? I would get upset every time he said to do it. Take a walk. Take a walk. Toya, take a walk. Would you believe? I started to walk. Not far. Just a little walk, you know. Follow music in my ears and walk. At least for 30 minutes. Then I started to go to an hour. Now, your girl does walk for an hour every time I'm off. I make sure I go in the botanical gardens nearby and I walk. And you know, I noticed a difference. I noticed that I felt different. I noticed that I felt, okay, the shift might be horrible, but I look forward to the walk. So, I would advise my colleagues, guys, take a walk. Don't tell yourself you have to join a gym and you have to pay all this money. Or if you can't afford it, you do it. But if you can't, take a walk. Take a walk. Relax. Take that moment. Manage your time so that you can have that time to walk and relax your mind. So, guys, these are all my points on how to deal with burnout syndrome. And I think that as well as you can seek help if you need to. You can go in and speak to a psychiatrist or somebody. But from what I have been doing and what has been helping me with my burnout is that I walk, I have changed my diet, I have started to take moments for myself, I have started to manage my time for myself, not just for work. Manage your time for yourself at home. We were trained to manage time at work. Manage your time at home. Manage yourself. Manage you. Love you first. The same way that you take care of your patients, take care of you. And help yourself to feel better. And remember, nurses do it better.